Stacy, got someone back there exercising.
There's a little kid in an egg.
Well, she's
I
at
was
the,
just looking to see, so I will try to take notes as I go, since we don't have a secretary or treasurer. Okay. Okay,
Would
so
you be able to do minutes for us?
what?
I was asking Tegan if she could maybe help us with minutes.
Absolutely.
Thank
I
you.
appreciate that, Tegan. Thank you. Okay, so I will start with introductions. Who do we have in the room? I'll start with Lonnie. I can see you.
Hi, name is Lonnie Jones. I work with Southeast Kansas Works. I'm the local business services representative.
Okay, thank you.
My name is Larry Jumps. My first meeting. I'm the community liaison for CCAP and the Early Childhood Education Services area.
and I'm Gladys Clark with my family in Southeast Kansas Mental Health Center, and I recruit for the early education.
Jessica McGinnis, the drug-free community coordinator for Allen County.
Okay, and I'm sorry, Larry, what was your last name?
Jump, JUMP.
Oh, okay.
Easy to remember, hard to believe. It's okay.
Okay, and I'm Carol Olson at the Emprise Bank and Chair of ACMAT, and we have Dawn.
Yes, this is Dawn Flores from Greenbush. I work with Linda.
Okay, and let's see. Stacy.
Yeah, I'm Stacy Cruisenberry, the counselor at the middle school, and I'm here with my Avita members. Hello.
Hello, all of you. Thank you for joining. Let's see, then who do I have? We have Tegan.
Hi, I'm Tegan Kern. I'm the drug-free coordinator intern.
Awesome. And Linda.
I'm Linda Weldon from Greenbush. I work alongside Dawn.
Okay. And to make sure I have. Okay, see, Clara.
Hi, everyone. Clara Meisenhelter, formerly Clara Wyckoff. I officially have my name changed now after being married. I work for K-State Research and Extension for the Southwind District. We cover Allen, Bourbon, Neosho, and Woodson counties, and I am the Nutrition, Food, and Health Agent.
Nice. Thank you. And Amanda.
I'm the Community Vitality Agent for the Southwind District with Clara.
Thank you. Bruce.
Hello, I'm Bruce Symes, Allen County Commission, and I work at the college.
Thank you. And Trudy.
Hi, I'm Trudy Hansen. This is my first meeting for ACMAT. I am with Parents as Teachers, and I service Erie, Chanute, and Humboldt.
Well, thank you for joining us, Trudy.
Thank you.
Okay. Tara.
Hi, Tara Solomon Smith, K-State Research and Extension.
And Debbie.
Debbie Higginbotham. I'm a therapist in a chemical abuse mental health at Southeast Kansas Mental Health Center, and I'm the project director for the Drug Free Communities Grant.
Thank you. And did I miss anyone?
I'll go. Hi, I'm Pamela Thompson. I work with KU with the grant called Family Strong through the Family Resource Center here in Pittsburgh, and I work through 8 different counties.
Okay, sorry, I didn't mean to skip over you, Pam.
Nope, it's okay. I'm a little under the weather today, so it's fine.
Thank you for joining. All right, and
April Jackson. I'm with Thrive Allen County, Southeast Kansas Recovery Resources, drug prevention and harm reduction programs.
Okay. Thank you, April. Anyone
Carol,
else that I missed?
We had 2 additional walk-in.
Oh, very good.
Marcia
Marcia.
Davis from Thrive.
And Patrick Zerjax from Thrive.
Okay. Okay. Do I have everyone now? All right, very nice. Thank you. All right, we were going to start with our agency, our recognitions. And Jessica, do you want to start with Avita?
Sure. We are doing some recognitions for the year. And our coalition has chosen the Avita group in Iola Middle School. These students have been dedicated peer advocates for promoting mental health and substance use prevention. They really highlight their leadership abilities and their qualities, emphasizing their ability to guide their peers toward positive and mental health practices. And I really want to congratulate them for their efforts on organizing educational events to increase awareness. And I think they've been doing such a great job. They wrote their own skit for a vaping prevention with the Resist group in Topeka, Kansas. And we are able to use that as a promotional marketing tool for upcoming years. So we really want to say congratulations and great job to you guys. And we have an award here for you, and we'll bring that to you guys on Friday.
All right, well, thank you all. We appreciate all you did. That's awesome. And then we were also recognizing Bruce Symes. Bruce was very instrumental with the CADCA conversations and also volunteering with the ice cream social. He ran the train at the family safety night. He's been very supportive of ideas and thinking of things from a commissioner perspective, and he's provided really great input. And so we appreciate all of your support, Bruce. And then we were also recognizing Lonnie Jones. He has been very instrumental in getting some activities going for us at the library and had some painting sessions. Was there 2 of them, Lonnie? And they were quite successful at the library. And so we really appreciate your efforts in putting those together and partnering with ACMAT to do, including us in those. So we appreciate your efforts on that. And so while we greatly appreciate all of our volunteers, but we just wanted to give special recognition to Avidam and Lonnie and Bruce for their contributions in 2023. So thank you very much. So.
Bruce, I have yours here. I will drop it off to you.
He's frozen.
It takes all of our volunteers to get anything done. So anything and everything that any of you can do is very much appreciated. So thank you. So, and we had who'd we have come in? We had Judge Kreitz and Amy.
You guys want to do introductions real fast?
Marie Barker with CASA and co-chair. Daniels with CASA.
Judge Kreitz, Dan Kreitz. I do want to make an announcement. We had a tragedy yesterday in the court. Honorable Tom McCulka passed away suddenly and unexpectedly yesterday, and arrangements have not been made. I was with the family last night in Chanute, in their Chanute home. So.
Good. Yeah. Our prayers go out to the family. Yeah. Wow. Whew. Okay. Our agency in the spotlight today is Greenbush, and Linda Weldon, the program evaluator, will be going over our KCTC report. Are you with us, Linda? Do you have access?
Linda, you're muted. Are you able to unmute?
Yes.
Oh, there you are.
I am unmuted. Trying to see which one I want to be on.
if you want to share any screen.
Okay, can you see the PowerPoint? Yes? Okay.
Yes, we can.
Okay. Like I said, my name is Linda Weldon. I am a program evaluator at Greenbush, and I've been your DFC evaluator for a few years. So this is your 2023 KCTC data and your DFC data also. So what do we know about the KCTC survey? It's administered to 6th, 8th, 10th, and 12th graders in Kansas schools districts at no charge. Parents and guardians' consent is required. The 2022 amendment to the Student Data Privacy Act required administrative changes that impacted participation. The survey is anonymous, it's voluntary, and it's confidential. Since 1995, the survey has consistently shown to have internal content and external validity. It's funded by the Kansas Department of Aging and Disability Behavioral Health Services. This is the KCTC evolution. 1995 is when it started. In 2021 is when it went fully online. And 2023, past year's data, is where they had parent consent protocols that went into effect. As you can see from the data, 2022 participation, there was 247 schools that participated. 2023, there was only 193. And the number in 2023 is less than half of what it was the year before, which 43% of the students participated in 2022 and only 20% in 2023. The total number of students who participated was the lowest number since the KCTC survey has been administered in the past 28 years. The survey has been, a few years ago, it was decreased to, it put logic steps in. So if you say, no, I don't do alcohol, it knocks all the alcohol questions out. So it takes about 27 minutes to complete the survey now. And the results for this were published March 13th. The survey that the 2024 survey will end the end of January, and they're hoping to have results ready sometime in February. So your DFC core measures, some of these are with KCTC data, and some of it is specific to your drug-free community data and is not on the website. Your counties are required to report following measures for alcohol, tobacco, which is cigarettes, marijuana, and prescription drugs. There's 30-day consumption, perceived risk of harm, peer disapproval, and parental disapproval. So there's a total of 16 questions that have to be reported for your DFC grant. Allen County data. You can see here that Allen County has been persistently higher than the state average, I believe, every year. Well, 2019, you were a little lower than the state average, but since then, your data has been, more students in your county have participated than versus the state. This is a little small, but it's rating by percentage the substances, 30-day past use substances for the students. And the first alcohol is 5.95 as the highest. Vaping, which is 4.64, that is not a DFC or a KCTC cert. Well, it's been added to the KCTC survey, but it's not required on your DFC. Binge drinking is 3.26, and that's third, and marijuana is 1.36. Your participation for this past year, 80% of the sixth graders took the survey, 66.67 of eighth graders. Yes, sixth graders are 80%. 66.67 is eighth grade, 10th grade 37.12, and 12th grade was 24.29. A lot of the 12th grade data you won't see because it's under the 25% threshold. So we'll see what shows up on this. Past 30-day use. On this, it's on how many occasions, if any, have you had alcohol in the past 30 days. In 2022 and 2023, Allen County students reported the lowest rates of drinking than the state. And so you've done very well with that because it started out in 2019 at 15.74, and now 2023 it was down to 5.95. So that's awesome.
Linda, this is Bruce. Is that all three of our school districts that participate?
I don't know how many did participate. We don't get that kind of data. This is for just the county itself. So
So anyone in the 3 schools that took the survey is on here.
yeah.
So if the school took the survey, then it is included in the information. Is that?
But we never know who, which schools are registered, or we just don't have, we're not privy to that data. So so this one is, how frequently have you smoked cigarettes during the past 30 days? And Allen County data has fluctuated over the past 5 years. It went from 2.81 to 3.15 in 2020. And then after that, it has went downhill, which is awesome too.
And Linda, can I interject just a moment?
Sure.
Okay, so one thing that to keep in mind when you're looking at this information too, is that you have had a higher number of your younger students taking the survey. For example, last year you had 80% of your 6th graders versus, like 24% of your 12th graders. And that does tend to change the data somewhat as well. So sometimes I know Linda probably has some like grade level information, but when you're looking at overalls, keep in mind that the older students will typically use at a higher rate than the younger students. And so if you have proportionally more younger students and fewer older students, then overall that could look like that there was a decrease when maybe it was really just your population. So I just want you to keep that in mind when you are looking at trends. You also have to dig a little deeper into the actual proportion, and your DFC folks do get that by grade level and gender as well every year. And I know they're keeping a close eye on that as well. So just a little note when you are looking at these.
Thanks, Don. Next. And although this is not a DFC question, here's some information on vaping. Frequently have you vaped during the past 30 days? Started in 2021, and that was at 9.30. This year it's 4.64, which it has decreased. And it showed that, well, 2021 and 2022, your rates were higher than the state, but this year in 2023, they're lower. And how many occasions have you used prescription pain relievers tranquilizers, or stimulants not prescribed to you by a doctor in the past 30 days. On this one here, this is, all students. It started out in 2019 at 3.75 and rose a little during 2020, which was with COVID. So things are really different when COVID. COVID 1.46, and now it's down to 0.8. This is your past 30-day use. It is my internet connection's unstable, so I hope I leave. So this was by grade, and it was alcohol.
All right, Londa, we have a
So-
question here.
Okay.
So this is Judge Crichton on the vaping stuff. So have the older, do we know what the participation rate was for the older kids? In other words, obviously those vaping things are going to be skewed a lot. And if we're just have participation from the younger 8th graders, for instance, we're not going to have, I would assume the numbers would be higher. I mean, vaping is a real problem in drug court and getting worse. People that come into drug courts. So, and I anticipate that being a big problem in the next 2 years. So I'm really interested in how valid those numbers are.
Been away for a minute, so I don't know that I got all of your question. Don, is there
I think
something?
Judge Kreitz was talking about the vaping information and that information. So what what we would have to look at, Judge Kreitz, would be the percentage of students that took it for the different grade levels. And vaping is not something that that's not required on the DFC information. But if you want, we can submit a request to our data. We have a data person who runs all of the analytics in the back end. And if there's something specific you want to know, we could try to find out the answer over time for those different grades for that vaping question for you.
Because they even said the seniors weren't counted because they were below 25%. So this is not that are ones that are probably been at the most.
Yeah. So okay, so actually, so the seniors are counted in the cumulative, but you'll see here in a minute when Linda does her, when she shows it by grade level, we're not able to report the seniors at the grade level, like usage, but they are in the overall count. But you're really smart to be keeping an eye on the fact that we do have that 80%, the 6th graders and that 24 12th graders. It is important. So they are in the cumulative count. It's just that we can't report them separately by grade, which is what I think Linda's going to do. Linda, when we lost you, we actually lost your screen also.
Okay, so I'm not sharing right now.
You aren't.
Judge Kreitz, I do want to mention that drug-free communities goals are tobacco, vaping, and alcohol. So we do a
I'm
lot
not
of
worried
research.
so much about tobacco. I'm worried about controlled substance,
Vaping marijuana or THC.
not just marijuana.
Delta 8 specifically.
9, 10, 11 plus. I mean, they're infinite. I mean, I've got all kinds of data and it's not good.
Scary,
And
isn't
it
it?
changes all the time. It changes all the time. Those manufacturers constantly are toying with that to avoid regulation.
Yeah, I agree. So I've got the vaping data up, so we'll go on to the next one. If my computer will agree.
Yeah, I think this storm has been doing a number on a lot of people's computers today.
So here we have 30-day use by grade. And here you can see there were a few of the 12th graders that did answer these questions. Alcohol is 18.3, so that was a large number. That was, whereas the 6th and 8th graders are 0.9 and 10th graders were 10.6. Cigarettes, those are pretty low. They are, excuse me, lower than the marijuana is 3.13, and whereas cigarettes is 1.7, marijuana is 1.2. But then when you get to the prescription drugs, it's only 6th and 8th graders that answer those questions. And then for vaping, 2.6 for 6th graders, 10th graders was 12.2, and 10th graders, excuse me, and 12th graders was 6.7.
So, Linda, I think in the beginning of your presentation, when you said that we weren't able to do the 12th grade data, I think maybe that was from you guys, I'm going to apologize. I believe that might have, is it possible that was from another presentation?
I think so. I believe so.
So I think because it's above 20%, they are reported. So I apologize for all the confusion about that in the morning earlier, but this looks like that they were reporting 12th grade. So if you're looking at the blue and you see 6th grade, you've got 0.9% of your 6th graders reporting 30-day alcohol use, 0% of your 6th graders reporting cigarettes, 0% reporting marijuana use, and then 0.9% using prescription drugs, misusing, and then 2.6% using of your vaping. So that's how you would read that. So looking specifically at that vaping question, 2.6% of your 6th graders are reporting vaping. Ironically, 0% of your 8th graders, which is kind of unusual. And then 12.2% of your 10th grade and 6.7% of your 12th grade. So looking at this, your 10th graders are the ones right now that are vaping at a higher rate. And I know, Jessica, you have this information over time. So if you want, we can take a look at that as well and kind of see what your numbers are doing.
Okay. The next one is perceived risk of harm. Do you think people risk harming themselves physically or in other ways if they take 5 or more drinks once or twice a week? This here is, excuse me, all grades together, the county. It was 76.30 in 2019, and it went down a little bit, and then it has risen. Now it's back down in 2023 to 79.40, which is still a little higher than it was in 2019. I guess 3 points, 3.1. Do you think people risk harming themselves physically or in other ways if they smoke marijuana once or twice a week? This here, it shows for the county, and it shows that you are below the state in 2021 and 2023. In 2022, you were just 0.07, 007 higher than the state. How much do you think people harm themselves physically or in other ways if they smoke more than one or more packs of cigarettes a day? These numbers are high, which is good because it's showing that the students altogether think that it is harmful. This is anyone who selected slight, moderate, or great risk. So it went from 90.55 in 2019. It's down to 88.62, which is lower than the state. And it went down and it goes up. It just kind of fluctuated, but you're down, which is great. How much do you think people risk harming themselves physically or in other ways if they use prescription drugs that are not prescribed to them? You started out at 89.54, and now it's at 87.84. And excuse me, on the last one, I said that it was lower and that was good. It should actually be higher. That's what you want. You want higher percentages. So you started out in 2019 and you're a couple percent lower in 2023. This is your perceived risk by grade. This is for alcohols on the left side. It's 79.9 for sixth graders. The highest is 86.1 for eighth graders. And the 12th graders have it at 80.0. For marijuana, it's showing, I'm just looking at 12th grade right now, 51.7, which is low. We'd like that to be a higher. 95.0 for tobacco and 90.0 for prescription drugs. It comes to, and I'll start over with the sixth grade. Their numbers have been mostly in the 70s. There was 1.6.18 for marijuana, but excuse me. Eighth grade is 77.8 and 10th grade is 78.6. This is marijuana. Tobacco is low for sixth graders. Eighth grade is 87.9, 83.3 for 10th, and 95.0. That is the highest on the of any of the scores that we have here for 12th graders. And then when you come to prescription drugs, 12th graders have it at 90.0%. The 10th graders, I'm looking, that is the highest that they have throughout all these other substances at 88.1. And 10th grade is 88.9, which is actually their highest. So again, you want these numbers to be high, because that way they're saying, yes, we know that there is a great risk by using these substances. This is peer disapproval. How wrong do your friends feel it would be for you to drink alcohol regularly or at least once or twice a month? 2019, 87.2. This 2023 was 89.8. So it dropped a little in 2020, and then it has went up each year after that. And these are the ones who chose wrong or very wrong. This is for tobacco. How wrong do your friends feel it would be for you to smoke tobacco? 2019 was 90%. This year, 2023 is 94.6. So it dropped a little in 2020, and then it has went up progressively since then. How wrong do you feel your friends, how wrong do your friends feel it would be for you to smoke marijuana? It went from 89.0 to 89.8 this year. It was lower 2020 and then rose up to 22.4 and dropped to 22.3. But this again is the highest number that you have percent. How wrong do your friends feel it would be for you to use prescription drugs not prescribed to you? This one is, in 2019, it was 93.6. In 2021, it was up to 95.6. Then it dropped down. Now it's at 96.2. So this is the highest that it has been in 2023. This is peer disapproval by grade. Your sixth grade looks to me like they have just about the highest numbers. Alcohol, they're at 97.5. Cigarettes, 100%. Marijuana, 100%. And 97.5 for prescription drugs. Then and there again could be how Don was saying that your younger grades, you have more of them participating than you do the 12th graders, which could be one reason why the 12th graders data is lower, but not necessarily.
Yeah, I believe that so these are percentages by grade, so I don't think that they're compared across. It's so in the cigarettes, 100% of your sixth graders, however many there were reporting that their peers would disapprove of them using cigarettes. And then of the eighth graders, 97.2%, and then 91.8% for the 10th grade, and then 83.3% for the 12th grade. And that's something that I think we fight across counties and across different coalitions have to work with, because the older they get, the more likely they are to think that something isn't harmful, or the more likely they are to think that their peers wouldn't disapprove, or their parents wouldn't disapprove. So I know that's something that you guys fight all the time as well, the older they get. So that's why you try to get them a little younger. So hopefully you can change their perception a bit over time. Does that help? Does that help, Linda?
Yeah, that does.
I would also suggest that if older students use a substance, they're gonna not opine that something is wrong or very wrong. So
Yeah.
even though this
Good
is
point.
pure disapproval, I'm sure usage is reflected in there too.
Yeah.
Yeah, good point.
Parental disapproval. How wrong do the adults you live with feel it would be for you to have one or more drinks of an alcoholic beverage nearly every day? And this is a DFC question, so it's not on the KCTC website. When you have a DFC grant, you do have some extra questions that are not on just the regular KCTC survey. This is adult disapproval, wrong or very wrong. 2019, it was 90.4. This year it was down to 89.1. There again, it fluctuated. It went down and up and down and up, and it's a little bit lower than it was in the start. But with the new data coming out in the next month or so, we'll see where it's at then. How wrong do the adults you live with feel it would be for you to smoke cigarettes? 96.8 in 2019. Then it rose up to 97.6 in 2022. And then it dropped back down to 96.6 in 2023. How wrong do the adults you live with feel it would be for you to smoke marijuana? 2019, it was 94.2. It went down, up and down, and now it's at 96.6. How wrong do the adults you live with feel it would be for you to use prescription drugs not prescribed to you? When this question in 2019 was 98.4, it dropped down, went up, went down a percent, 0.1%. And this year it's down to 97.5. Again, it'll be interesting to see what it comes up with the new data. This is by grade, parental disapproval by grade. So for alcohol, the highest one number there is the sixth graders at 93.6. The lowest is the 12th graders at 76.3. The eighth graders, 93.5 and 96.6 for the 10th graders. Numbers are, most of them are in the 90s, which is good because they're saying, yes, it's wrong or very wrong. Cigarettes were the highest number there was the 10th graders with 97.6. For marijuana, the highest number was 99.1, and that's 8th graders. And for prescription drugs, the highest was 99.1 again, and that's 10th graders. I guess that was the last one I had. So are there any questions?
Thank you, Linda. Oh, go ahead.
No, I will send out the PDF of this. I'll send it to Jessica, and that way you'll have the PDF.
Yes. we
I was slow
appreciate-
on muting, but I would like clarification on the vaping distinction you made, that it's not included in DFC. What does that exactly mean, and why not, and who decides that, please?
So sure. So the vaping, the vape, so the DFC at the federal level requires, and Jessica jump in because she's an expert on this, but they require you to report on alcohol, marijuana, cigarettes, and misuse of prescription drugs. And then they require those 4 questions that Linda presented. The DFC, they do not have vaping as a priority area or something that we're supposed to be reporting on. So as a state, we added a question a few years ago specific to vaping, but they don't have to report on it to in their federal reporting. So we showed it to you because we know it's important to your community, but it's not going up to the federal level as something that's being reported. Is that correct, Jessica? You're not reporting vaping?
That's correct. However, we have brought this up for the last 3 years that is the biggest concern. And so when we meet with our PO, our project officer, we're discussing this. And we are talking about what kind of data we are getting from the KCPC. But when it comes to like getting our core measures into the reporting system, that's what they're requesting right now.
Yeah.
But we are
So
looking at it as a county.
Yeah, it's very important to look at. It's just that the federal government hasn't identified it as a priority area. So we're giving it to you, but then Jessica's not taking it and reporting it. Although you may report it in your narrative somewhere or in conversations, but just not officially.
Yes, we definitely do that in our narratives of progress reporting.
And the vaping question is on the KCTC website. So that's their
You say
data.
that, go ahead, I'm sorry, Linda, I interrupted you.
No, go ahead, Dan.
When you say the federal government, what agency specifically are we talking about? Because I have that opposite.
The CDC.
Okay.
And it's been that way. I've been involved with DFC for about, I don't know, 8 years or so now, and it's always been that way. And there always has been a push at the local level. There's a lot of people saying, hey, vaping is important. We want to, target that. And but they haven't changed those measures. And vaping is a hard one too, because I think Judge Kreitz, you're the one that kind of alluded to it's not just in the vape, there can be, there can be the nicotine, or there can be the marijuana, or I guess it sounds like there can be other things too. So when you say, are you vaping, that's really hard to categorize because it's so many different substances. I know that's a tough challenge when you're reporting and you say, do you vape? Because we're really not sure exactly what they mean by that. What is it that they're vaping?
Question. Because of the huge decrease in the amount of students that are taking the survey because of the parental consent part of it, what if anything has been proposed to make that more manageable? Get more parents to consent or streamline the way it's done, or?
So we have to work with the school districts one-on-one to make sure we're pushing to make sure those consent forms are being signed.
Yeah.
So I'm working with people in the schools to do that.
Yeah, and the other thing, that's important, of course, working with the schools is very important. And I know you guys do a great job of that. And you have a very, very strong collaborations. But also any of you that happen to have any pull with legislatures or as a resident, making sure that your elected officials at the state level know how you're using this and how important it is. Because there is another group or another facet that says, that they don't want us to ask these questions of students. So they need to hear the other side and hear how you're using it for prevention as well.
What would be some of the reasons why they wouldn't want us to ask the questions to students?
Money.
A lot of
One word,
I hear
money.
I heard someone
Money
talking.
you make on vapes.
Yeah.
Not all of them. I mean, and then they change and they get around a lot of laws, federal laws very easily. And part of it is a farm bill, a federal farm bill. I mean, it gets real complicated, but it's money.
They're able to lobby the schools even and say, hey, don't be asking this, don't be doing surveys, or how they.
The lobby is tremendous at every level.
And
Please- please
it's really
stay
tough.
federal level.
Jeez.
Yeah, they're making it harder. They've in 2015, you know, they did the opt-in versus the opt-out consent, which is fine, and the districts were able to adjust. And now they've changed to where the consent has to be within 4 months of administration. That makes it really, really hard. We adjusted our administration to make it a month earlier in October instead of in November. But a lot of schools, they used to, in April or so, they would do their registration and they would just get all their consents and everything at the same time. With the new legislation, they can't do that. They actually have to do it later in the year, which has made a really tough hardship for Deborah and Tegan and Jessica and all the others that are working on that, because now the districts have to completely shift. So every time we think we have it figured out and we're able to do it, something new happens. Yeah. A new law or new regulation that makes it hard for the districts to shift. They have so many other things going on that you know, sometimes this can be not a priority. We know that they're busy and they have a lot on their plate, right? So we do our best to try to make sure that we make it as easy as possible, and we provide a lot of resources for the schools and for communities, but it's really tough.
Because I believe right now for that consent, we only have 3 months to take the KCTC. From when we get the consent, we only have a 3-month mark. Isn't that correct?
I think it's 4. It's 4 from the, yeah, okay. 4 from the time that it's signed. But it's tough when you're used to doing it in April, and the consent, you know, the KCTC survey, even starting it earlier in October, it still doesn't meet that 4-month window. So it's just tough. It's really tough. So what you guys can do is, whenever you do talk to your local legislatures, just explain to them how you use the data in your community and how it's important for you. And I think that that's probably the best thing that we can do to try and combat it. Otherwise, we just be as supportive to the schools as we can and do what we can to get it. But it is important, and it's a shame that it's becoming so tough. Oh, someone has a comment. Pamela has a comment. Education of the public about why they're important.
Yep.
Yeah, I
So
just think,
Jessica, can you answer my earlier question about, do all of our districts participate?
So to my understanding, all of the districts did participate, to my understanding. And then we can individually go and ask each school district for their data if they would be willing to share. But each school district would be able to give you that data.
Okay.
I think it was maybe 2018 or 2019. We did have a school district that did not participate, and it really skewed our numbers. But since then, we've been trying to build that relationship back to be able to get back on track with that.
I think it was a high school in particular, right? There was a particular high school that didn't participate, and then maybe at another point a district. So, and that does affect the numbers. Really making sure that participation at all grades is there so that you can get an accurate picture is really important. But
COVID was a real skew as well.
It does. It makes it tough.
You also got parents that don't want their kids to participate because they don't want their kids to tell them what's really going on.
Yeah.
And and it's absolutely the
Parents
students'
are
right
doing it
not
with
to
them.
participate. And it's the parents' right not to participate, but they get to make that decision, and we're perfectly comfortable with that. But it's just tough when they don't have the opportunity to say, yes, we want to participate, because they've made it so difficult for districts to be able to participate. So then the students and families that want to can't.
Very true. So are there any other questions? I think that's all that Don and I have for you today.
Well,
we appreciate.
Yeah,
Thank
you
you
very much, Linda. There's lots of good information, good discussion and questions.
It is, and it's a lot coming at you at once, but you'll get the PDF and then you can, Jessica can distribute that to everyone and then you can look at it and get a little bit more time with it. So anyway, we appreciate you having us.
Yes, thank you so
Brenda. Thank
much.
you,
All
John.
right. Okay.
Thank you.
All right.
Okay, so we'll quickly try to get through the rest of our agenda. I assume everyone has had an opportunity to review the consent agenda. Do I have a motion to approve that consent agenda?
A motion, Mary Parker.
Okay, thank you. A second?
Judge Kreitz, second.
Okay, thank you, Judge. And old business, we just wanted to discuss donations to Hope Unlimited. I think that project went fairly well. We had some nice donations and Jessica and Tegan went around and gathered all those up and delivered those to Hope Unlimited and took some pictures and had those posted on Facebook. So we'll call that a success. New business, we're just looking for volunteers. If your agency is interested in being our agency in the spotlight, you can let me know or you can email Jessica and let us know what month you might be interested in and sharing about your agency. And I will let Jessica talk about Tony Hoffman.
So we have been working on bringing a nationwide speaker into Allen County to talk with our 6th to 12th graders. We have scheduled to have the speaker come in March 21st at the Bolus Fine Arts Center. We've partnered with the Bolus. We are using KDAD grant funds to help us pay for the speaker. Each school districts get $3,000. And so we're going to put money towards that. KDADs would like to see us partner with our community partners. So Tegan and I went today to present to the Allen County Commissioners, and they were kind enough to give us $1,500 towards that event. So we're pretty excited. With any kind of extra funds, we will be using those for travel for youth, for events, and then also trainings and any kind of activities they want to do. I believe the fiscal year for the Y-Link group is in June. So I believe if we have to use them or we'll lose them kind of situation. So we are working on getting events and activities set up for the youth on that, but we're pretty excited. Tony Hoffman is known for struggling with anxiety, depression, suicide ideation. In high school, he became addicted to drugs. He was an opioid addict. This then came to poor health, poor mental health, going into crime, becoming homeless, and then eventually going into prison. And since his parole, he set goals while he was in prison to become a BMX professional rider and to go to the Olympics. So when he was able to get parole, he worked for those goals, became a BMX professional bike rider. And then he also went to the Olympics, the Rio Olympics, coaching, I believe her name is Brandy Crane or Brooke Crane. And she received 4th at the Rio Olympics. So he's very inspirational, talks about his struggles with mental health and substance abuse. So we really think it's going to inspire and motivate our youth to make better decisions. So we're pretty excited about that. But again, we're looking to partner with any kind of community partner that would like to help with this event. If you guys have any questions or need further information, please reach out to me or Tegan.
Is the cost covered now?
It is covered, however, because of the state, the full amount is $9,200. The Y-Link grant could cover the $9,000 again, but that would take out all expenses for any kind of future activities. So again, they would like us to see if we can get any kind of sponsorships to kind of offset those costs. And then I believe it takes 30 to 90 days to get reimbursed. So.
Is he related to, was it Matt Hoffman, like in the 90s, the BMX surfer?
Tony Hoffman?
Yeah. Does he have a brother named Matt?
I have no idea.
Well, that's like the Tony Hawk era, right? Of like skateboarding and all.
BMX?
Yeah, BMX.
Sure. It's a good question.
So my question is, so is it paid for? Is that something we're still, you're waiting?
I'm still working on getting
And how much more
sponsorships.
money do you need?
We would like to see if we can get probably at least $2,000 more to offset that cost.
Did you see the chat, Jessica?
No. Oh, awesome.
Who is it? Can't see.
SEK Recovery Resources that are agreeing to sponsor. I'm sorry.
Who is it?
April.
Yeah, okay, awesome.
That's fantastic, April. Thank you so much.
That's amazing.
April.
We're able to
Obviously, what's
get some grant money, so, yeah.
Thank you. Obviously, with sponsorship, we will be recognizing and sponsoring all event materials and marketing. So greatly appreciate that.
Thank you, April.
Awesome. Okay, any other thoughts, conversation on Tony Hoffman? I think this is a great opportunity for us to get him, and I think it's going to be an awesome experience for the kids. So, chamber dues are coming up. Iola's cost is 165, Humboldt is 25. Does anyone have any thoughts, questions, thoughts on, are the chamber dues, is that buying us anything, or is that something we want to continue? Any feedback on that?
I feel like the Iowa Chamber has been doing great with getting all our information out. They've been great partners. I think Humboldt still, has a brand new director, to my understanding.
Right.
So I think they're looking to do a lot more marketing on their end.
I make a motion, we take both.
I get a second.
I'll second.
Thank you, Lonnie. I will let Kristen know. Oh, all in favor, say aye.
Aye.
Anyone opposed? Okay, I will let Kristen know to get both of those paid. Thank you. And then just thinking about 24 community events, let us know what you've got going on. How can we partner with you? You know, so just kind of be thinking about that. Let us know what's coming up. And yeah. So I'm not right now. I think we're kind of in a lull after the holidays, and so we'll take the lull for the moment. But as things start coming up, just let us know, and we'll see what kind of partnerships we can come up with and get things going. So
We are
just
looking at Family Safety Night in June, correct?
yes. And I think we talked about probably trying to get some sponsorship and donation request letters going out in March. So. Next would be you, Jessica, for your update, you and Tegan.
Well, during the winter, we've had a little break with the kiddos being on break. So we've been doing a lot of the administrative work, obviously doing a lot of organization when getting the speaker coming in with the bolus and the school districts. So that was been our main. We are organizing and registering youth to go to a Y-Link and Resist event in Topeka. Those are also in March. So we're looking for youth that want to advocate on substance prevention and mental health. We're currently working on that. And then we were going to have Y-Link program director come in on Friday to meet with our Iowa middle school group. We are still working on the environmental stands. They would like to do a presentation to the Iowa Public Library on the finds that they came across. So we're kind of just working on that and setting it up and trying to kick off them coming back to school. Tegan, am I missing anything? That's about it.
Okay.
Short and sweet.
All right, anybody have any updates from their agencies they'd like to share?
I have one.
Okay,
We're having, or the La Harpe Pride is having a health fair on January 20th at the La Harpe Community Building from 10 until 2. They will have some vaccines, pneumonia, COVID, shingles, and other agencies will be there sharing what resources they have.
all right, thank you. Anyone else?
I'll share. This is not exactly an event, but I put some information in the chat. So Kansas 4-H has had a grant for the last 3 summers to hire interns. And we have been selected as a host site for the 3rd year in a row. So that will include being able to host interns at our offices in Iola, Fort Scott, Yates Center, and Erie. And the pay for the grant-funded internship is $17 an hour. And so I put the link in the chat. You could also send me an email if you have questions. The deadline to apply for best consideration is January 21st.
Okay, thank you.
I'll give another one for our organization. We have a Stay Strong, Stay Healthy 8-week physical activity strength training course coming in Iola starting February 6th. It is a $20 fee. It's twice a week for an hour and $20. You can just let us know if you want more information on that.
Okay, thank you. Anyone else? No other updates?
Sandy put in the chat that they are doing a diaper food collection drive for KCSL next week in Chanute for Martin Luther King Jr. Day of Service. And AmeriCorps seniors RSVP at NCCC.
Okay.
And then also Hoops for Hope. I don't know what that does.
Okay.
You guys in the chat can open that up.
And then Pamela has something in there. What's that?
Pam, she put our grant is working on Allen, Bourbon, Cherokee, and Crawford, Neosho, Labette, Montgomery, and Wilson. Oh, Leandra Hancock, is that correct? Works at Allen, Wilson, Neosho, and their information is in the chat if you need it.
Okay, yeah.
And what else? They're saying I'm unable to open attachments from the chat. Okay.
I think the Hoops for Hope is like a cancer or children's medicine. We used to do it in school out in California. And it's like, I don't know if it's the same thing, but the schools would volunteer and have kids shoot hoops. The kids went around getting like how many they could donations.
I remember something like that.
Very nice. So, okay, so we've got some activities going on. So, all right. Anything else? Okay. I have a motion to adjourn this meeting.
Mary Parker.
Okay, thank you, Gladys.
Second, Judge Craig.
Thank you, Judge. And all right, this meeting is adjourned and I will see you all next month. All right, thank you all have a great day.
I think that's
Bye.
Matt Hoffman, Pro BMX boarding. I think they do.
What's your name?